Now we're going to talk about a type of necrosis. That's a type of tissue damage. When tissues damage, how can you now be able to spot it out? So that is what is known as a chalky necrosis of tissues. Chalky necrosis of tissues. That means tissues died and they're actually becoming whitish like a chalk. Chalky necrosis of tissues. Alright, so it's a type of what? Identification of necrosis. Alright, so it's very nice. It's something that they can actually ask in your oral exam is anatomical pathology and all of that. So it just refers to fat necrosis, where dead fat cells, they release fatty acid that combine with calcium. So it's a reaction between fatty acid and calcium that forms whitish stuffs that look like chalk deposits. Do you understand? So definition is a necrosis of tissues due to injury, infection, or lack of blood supply. So usually due to fat necrosis. So fat cells will now lead to what? Release of fatty acid combined with calcium to actually give you the chalky appearance. So the chalky appearance is fatty acid reacts with calcium, a process called saponification. It produces what? Insoluble calcium soaps. So that gives the tissues a chalky white gritty look. Right? So common sites you can always see this type of necrosis: the pancreas, breast tissues, subcutaneous fat in areas of necrosis. I'm actually surprised they didn't actually list the lungs. The lungs seem to be one of the most common, but breast is actually the most common. Breast cancer is the most common, followed by lungs. Alright. So microscopic features is that necrotic fat cells are surrounded by basophilic, that's blue staining what? Calcium deposits. Sometimes you have inflammatory cells. So clinical significance is it may actually mimic tumors if you do an imaging of it. Okay, especially in the breast. That's what I'm always telling you guys that it's very common in breast cancer. Alright. Indicates severe tissue damage and enzymatic activity. Of course, indicates that all the cells that are dead, you know. So in pancreatitis, it can contribute to systemic complications due to the release of fatty acid and enzymes. Okay. Chalky necrosis.